And you're listening to the Lunchtime programme here on News Talk 106 to 108. The text line for your messages, if you'd like to comment on anything you hear throughout the programme, is 53106. Now, the hospital system in the country appears to be slowly choking. It's certainly creaking at the seams. Winter is not yet upon us, but there are reports of record levels of overcrowding. The unions in the medical sector are claiming that 2,000 acute beds have been shut down. On top of this, it seems that the hospitals are having problems filling junior hospital doctor posts because the vetting process is so cumbersome, and large numbers of nurses that are trained at vast expense are being asked to emigrate or else induced to emigrate by the promise of nice salaries and good climate. Dr. Rory Hanley is a general practitioner. He's also a regular columnist with the Irish Medical Times, and he has strong views on this issue. Dr. Rory Hanley, good afternoon.
Good afternoon, Damien. How are you?
Now, first to the nurses. We're spending a lot of money training nurses. I think 1,600 in the last year. There's no jobs for them. Are they all? It's going to be a dead loss to the country. Is that right?
It sounds like it. Yeah. I mean, it's a terrible situation when you think of it. You know, the state spends a lot of money training these nurses. They're dedicated. They want to work in this country, and what's happening is there's simply no jobs because of cutbacks, because of recruitment moratoria, and so on. So as a result, they end up emigrating. So I mean, it's a great gain for the Australias, the New Zealands, and the Englands of this world, but it's a great loss for Ireland. And when you look at the suffering that's going on in trolleys up and down the country, you begin to realise, you know, the money has not been spent on nurses, it's been spent on administration, you know.
Well, the nurses are frontline workers in the service, but the recruitment process is actually quite simple. There are people coming here from New South Wales to Harcourt Street, which is only a couple of streets away from us here at News Talk, and they're offering people starting salaries of 40,000, rising to 54,000. The climate in Australia is good. There seems to be an upbeat atmosphere there. Yeah. It's inevitable, isn't it?
Oh, it is, and we're seeing the same thing with doctors. I mean, I know plenty of young, newly qualified GPs and hospital doctors, and they just basically are emigrating. And Australia is the place to go to these days because it's a booming country, it's a lovely climate, it's an extremely well-run health system. They pay their doctors well. You never hear those who give out about doctors' salaries talk about how much they're paid in Australia because they're paid just as much, if not more, there. And so basically, they're leaving in droves. So we're actually having a recruitment crisis in non-consultant hospital doctor level as well as nurses, and this is basically because the opportunities are better in other countries where they treat them better. It's that simple.
Dr. Rory Hanley, a lot of people can't understand this because on the one hand we're investing like the number, I think, for the nurses training, it costs 140 or 150 million a year, and there's a drift of our people out of the country, and yet we're trying to import people from overseas, and we're having problems doing that because we don't seem to have a vetting system that's up for the job.
Well, if I can't really comment on the nursing situation. If you're referring to the non-consultant hospital doctor situation, I think what you're getting at there is about the 280 doctors that were recruited to make up the shortfall, only 60 of whom have been processed. That's what you're referring to?
That's absolutely right, and they're apparently kicking their heels in bed and breakfast while there's lots of sick people need attention.
Yeah. Now, this is a very good question. What is going on? And this is a combination of medical council bureaucracy, HSE inefficiency, and general overall state incompetence here, right? Because we need these guys, okay? Because of the aforementioned immigration problem that I referred to there a minute ago, we have a shortage of doctors in key areas at non-consultant hospital doctor level throughout Ireland. So the state, in a panic moment, said, oh God, we need to get these guys. So they went on this mad recruitment drive to India, Pakistan. Let's get as many in as possible. Now, first of all, I'd say it was an entirely predictable event. They should have planned for it years in advance. They failed, but okay. So then they brought these guys over, and now they're saying, right, well, they didn't have sufficient documentation. They didn't have, we can't get them through the medical council process. All of this is predictable. All of this is obvious. Every doctor in this country deals with the medical council every year. We have to re-register. There's a process. There's forms to be filled out for people registering for the first time. It's predictable. This should not have happened. Okay? And I really can't understand what's going on here. Now, there's blame, a lot of blame can be spread around here. Okay? The medical council process for applying is very cumbersome. It is very slow. Okay? I was looking just before I came on air to talk to you. I recently changed from the general register, about 2 years ago I did, from general register to specialist register. I had to fill out a form 16 pages long. Even though I've been a doctor in Ireland for, 11 years now, even though I've qualified in this country, even though I did recognised specialist training, I had to fill out a form 16 pages long. I had to get loads of supporting documentation, and the process actually took months. and that's for somebody who's been living and practicing in Ireland for all his career. These guys have been brought in from overseas. That process is obviously going to be even longer, but there's seriously question marks have to be raised about the efficiency of the process at medical council level, I believe.
Well, you said to us before that there are 17,000 administrators in the health system.
Yeah.
Surely this kind of work can be done.
Well, it should be. You're absolutely right. I mean, let's ask ourselves a question. The HSE were able to find these guys. They were able to bring them over at the state's expense. They were able to put them in accommodation and find houses for them. They were able to do all that complicated stuff. Yet when it comes to getting the forms filled out and the registration...
Check their qualifications. They can't do it.
Well, they can't find their qualifications. But I mean, that surely to God, before you brought the guy to Ireland, you should have seen his degree, seen his qualification, seen a copy of it, got a certified copy of it before you even flew him into the country. I would have thought that would have been a prerequisite, you know. I mean, it doesn't strike me as inspirational planning here, you know. But anyway, the other thing they had to do, to be fair, was a clinical competence skills test. Now, that's important. That's fair enough. And they had to do that in Ireland. Good. 88% of them passed them. So we know they're able to do the job. 88% of them are anyway. So basically, why aren't those guys getting registered fast? What I would do, if it was left up to me, is there's about 150 guys need to get sorted. You need to put them in a large room, in a hotel, rent a function room, put 150 guys in a room, bring down 10 guys from the medical council with all the paperwork, bring down 10 guys from the HSE, and not leave that room, get them fax machines, get them whatever they want, spend a day there until it's done. But what's happening is it's been done piecemeal. Letters are going in, bits flying over and back. Oh, let's get this bit, let's get this contract. And it's very, very messy and cumbersome. And it's just typical of the kind of bureaucratic, Soviet-style stuff that goes on in this country. And our health service is suffering as a result.
Now, at the outset of the interview, I mentioned that there was a number in the ether of 1,950 or so acute beds having been shut down within the hospital system in the last few years. And that figure, believe it or not, I think comes from the Irish Nurses and Midwives organisation. So it seems that the government, for the second time in a row, has basically handed the task of compiling data on the health system to effectively a trade union or a staff association. This is quite extraordinary, isn't it?
Well, it is, but in this instance, the government are going to the Irish Nurses and Midwives organisation, I expect, because they're the guys who give them the real figures, because they're the people who are working on the front line there.
Yeah, but you have the HSE, and that's supposed to run the system, and they should surely know how many acute beds are in their system.
They should, but as we've discovered in the past, do you remember the trolley counts? It's the Irish Nurses organisation that provides the trolley count, and when the HSE were asked to provide their trolley count, it turned out to be significantly less than the INO one, because they deliberately took it at a different time of day to try and minimise and massage the figures, you know.
So you prefer the INMO one?
Well, not just me. The Minister for Health has said the INMO one is the only credible one, which means that the HSE figures have been misleading for a number of years. And I agree that's a damning indictment of the HSE and their entire culture of spin and misinformation, in my opinion.
Well, OK, supposing there are 2,000 acute beds shut down, which is probably true, what does this mean in practice?
Well, it means hundreds more people on trolleys. That's what it means in practice.
And long waits in A&E.
Oh, yeah, we see it. The problem is, as I've pointed out in the past, we have an acute bed shortage in Ireland anyway. We've had a rising population of roughly 1.5 million since 1980 and we've lost 30% of our acute bed capacity in the same period. So, you know, we've always going to have this issue. Now, what's actually going on is the private hospitals in this country have been taking up the slack. So were it not for the vast number of people who pay VHI and get procedures done in private clinics up and down Ireland, our hospital system will actually collapse. So we have this kind of warped thinking then comes in that, the problem is the private sector. Let's go after them. They're the bad guys. That you hear that from a lot of left-wing politicians. That's nonsensical. If you nail the private sector, the bed crisis gets worse. The private sector is possibly the only part of our health system, our hospital-based health system, that's actually working efficiently because it's in their interest to do so, because they are profit-driven. You cannot run an inefficient HSE-style operation in the private sector. You'd simply go to business in a day.
Yeah,
you know?
Apparently the cost of a long-stay bed in the private sector is €875 per week, whereas the cost in the public sector is $1,245. This is slightly preposterous, is it?
Well, it is, but you see, that's because in the public sector we're not just paying for the bed, we're paying for 17,000 bureaucrats, we're paying for inefficient work practices, we're paying for a culture of administrative incompetence. That's what we're doing. We're paying this kind of heavily unionised bureaucracy, culture of poor management and inefficiency. I heard James Riley on the radio this morning. He was talking about management. He was making a very good point. He was saying if a consultant turns up for work and he's there, he's been paid, and he wants to do an operation, he's there, he's doing his bit, yet there's no bed for the patient to be in, so he can't do the operation. There's no theatre nurse because they're not recruiting them. There's no porter to bring the patient to hospital. There's no anaesthetist available, whatever. He can't do his job, but they have to pay him. So he's being paid to do nothing. And that actually happens around this country. I know consultants, I've spoken to consultants who sat there and say, the only way I'm keeping up my skills is to go and operate in the private sector in my spare time, because I'm not actually getting to do as many operations as I'd like to.
Dr. Hanley, what you're talking about is coordination here, because apparently for some very complicated surgical procedures you need upwards of 12, maybe 15, maybe 18 people to be present in an operating theatre.
Oh yeah, absolutely.
Yeah, and so if 3 or 4 of those people are not available, the other 15 are stood down, and yet they have to be paid.
That's exactly right, because they're public sector workers. Now that doesn't happen obviously in the private sector, because it's paid per procedure. You know what I mean? That's how they get their money in the private sector.
So they get their skates on and get everyone assembled on the day.
Well, they make it their business to do so. Whereas in the HSE, there is not that incentive. Now James Riley's given his credit, is trying to introduce that ethos, or has spoken about introducing that ethos to the HSE. He's talking about the money following the patient, and that's where he's getting at with this. Do you see what I mean? Basically, you're paid not a budget per annum, but for the number of procedures that you do. Now, that would be a very positive development if it ever happens, but wait till you hear the wailing and screaming from the public sector unions when they try and introduce that,
This government has been in office for 5 or 6 months now. Do you have any sense, finally, of hope that there will be a serious effort made to address these administrative problems?
My hopes are fast fading, to be frank with you. I'm not hearing any plan to cull the number of administrators. I'm not hearing any plan to increase the number of acute hospital beds. I'm hearing a lot of good emotive sound bites, but I'm concerned, and I mean there are a lot of smaller little issues out there that I think could blow up. I'll give you one example, Damien, just because it's on my mind at the moment. You may have heard about the annual flu vaccine campaign being given over to pharmacists. Did you hear about that a few weeks ago?
I did, yes. We covered that on the programme, actually.
Yeah. Now, I have no problem with pharmacists doing it. There's absolutely no problem at all. But at the moment, nobody knows what's happening. I mean, I'm working...
Sorry, explain that?
Well, basically, every year us GPs across the country, we sit down and we order our flu vaccines for the...
For sure, for your patients.
For our patients. What are we supposed to do now? Are we supposed to order them, or are the pharmacists doing it? We haven't been told.
And as we speak, this is early September. Have you got the flu vaccine in your clinic there?
Well, in my own practice, we're at the ordering stage now, but I won't comment on my own direct practice. But what I'd say is, on a general observation, this is the time of year which all practices would be considering ordering their flu vaccines for the season.
But you don't know where you stand, basically.
We don't know where we stand. How many should we order? Are we doing it? Are the pharmacists doing it? So what we got was this.
We could be like forgive the analogy, it could be like the salt on the roads when the weather gets bad.
It could be, yeah.
We'd all end up with no vaccines. Is that it?
Well, yeah, but exactly. Well, I don't think that'll happen. I think in the end they'll muddle through. They always do. But the situation is, we turn on our radios and we're told you're not doing it. Now, personally, I have no objection. Some GPs do object, but I have no objection to pharmacists giving the flu vaccine. It's fine by me. I think it's perfectly safe. But we need to know, for planning purposes, again, it goes back to planning, who is going to be doing this, how is it going to be implemented, and how are we going to make sure that people who need this vaccine get it. This soundbite was released. We're going to get pharmacists to do it. Isn't this a great idea? And we're going grand, and we've been told nothing. And representative organisations, the ICGP and IMO, I gather, are kicking up about it. But the Minister made this announcement, and then we spent the whole month of August and we heard nothing about it.
You have no circulars from the HSE or the department about it?
Well, we're waiting to get clarification. We've got circulars on who should be getting the flu vaccine, but the question is, if you're in a GP surgery right now and you're not sure whether the pharmacist is going to be doing it or you're going to be doing it, how many vaccines do you order? I mean, I fully expect, by the way, between ourselves, that the GPs will be giving the flu vaccine this winter. I don't think there'll be sufficient pharmacists to do it all. So I think we in GP will be doing it, definitely. But the question is, how many vaccines do you order? How do you plan for that, not knowing what the clear, coherent plan is? And that's the kind of small-scale thing. It's a small-scale thing that could blow up into a big thing. It'll probably get sorted next few weeks. But it's just a lack of communication and the lack of kind of centralised planning that really irritates when you're working in this business. You know?
Absolutely, we take your point. Dr. Rory Hanley, a general practitioner, columnist with the Irish Medical Times. Thank you very much for joining us here on Lunchtime.
Take care, bye-bye.
We're joined on the line now by Junior Minister Roisin Shortall, for Minister with responsibility for primary care. Minister, first of all, can you outline to us who is going to be administering the flu vaccine this year? Because Dr. Hanley and many of his colleagues don't seem to know.
Well, good afternoon, Jonathan. The position is that, as usual, we will continue with GPs providing the winter flu vaccine, and in addition to that, we're hoping that a number of pharmacists will start to administer the vaccine also. We want to achieve the greatest possible coverage of our uptake of the flu vaccine, especially among kind of groups that would be regarded as being at risk. And the decision was taken earlier in the year in the Department of Health here to consider the possibility of pharmacists providing the vaccine, a practice that is common enough in other countries. And we've been pursuing a number of different avenues in relation to that, and just checking with the legal situation. And the advice for us is that it will be possible for pharmacists to provide the vaccine, and at the moment we're looking at the logistics of doing that for the.
Were you aware of the confusion that was out there amongst general practitioners? Because traditionally they would have been the group with sole responsibility for administering this. Did you know that they had concerns?
I knew they had concerns in respect of the possibility of pharmacists doing this job as well. It is the intention of the department to continue to encourage GPs to provide the vaccine, but also that we would be able to provide it in local community pharmacies as well.
What about the end user here, the individuals who are going to get the flu vaccine, who need the flu vaccine because of a variety of different reasons? Is there not confusion out there now as to whether they're going to go along to their local Boots chemist or whether they're going to their local GP? Is there a campaign of any kind going to be announced in the weeks ahead? Because the time is ticking here. Flu is probably just around the corner.
Well, everybody will be able to get the vaccine if they attend their local GP. As usual, people have been doing that. There will be campaigns to encourage people especially people at risk, to avail of the opportunity to get the vaccine and avoid the possibility of them picking up the flu during the winter months. But, what we're saying is that at this point we're very keen that the winter flu vaccine would be available on a wider scale basis, that we would also have pharmacists providing it. We're doing everything we can to ensure that can happen this winter. The timescale was tight enough. Minister Riley and myself discussed this in recent months. We were keen that pharmacists would carry out this work.
It is a sea change, and it's a welcome sea change, because the idea of having to go to the GP, and I know a lot of people would have had an issue with the fact they would have had to pay the GP fee if they didn't have a medical card. So the idea of going to your local pharmacy is a good one. But how many pharmacists are going to be in a position to actually do this? How many are qualified and trained and know what they're doing to give the flu vaccine, which is due to be administered probably within the next few weeks?
Well, Jonathan, I fully appreciate that the timescale is very tight. When we discussed this, the lead-in that is required is considerable, and there are a lot of logistical issues to be dealt with as well as legal issues, and they are being worked through at the moment by the Department of Health and the HSE. We're hopeful that we will be in a position for pharmacists to provide the vaccine. Pharmacists are very keen to get involved in this new area of work, and we're doing everything we can here in the department to ensure that can happen this winter.
Roisin Shortall, Damien Kybert here. Is there an administrative backlog emerging in relation to this, or is it likely that we'll have to wait another year before the scheme of the pharmacist providing the vaccination gets off the ground fully?
Damien, I hope not. I've certainly been working very hard to try and ensure that it happens this year. As I said already, it's a complex enough change in policy and in terms of ensuring that the right legal steps are taken and the correct administrative steps are taken too, in terms of getting the vaccine out to pharmacists.
Well, you've referred about 3 or 4 times to legal issues. What are the legal issues?
Well, in terms of at the moment, there was a view that there may be a need for legislation, primary legislation, in order to empower pharmacists to provide the vaccine. Our latest advice now on that is that can be done by regulation. The Minister for Health can make regulations So that has been an important breakthrough in terms of making this happen this year.
So it can be done by ministerial order, effectively?
Yes, that's right.
Yeah, and you think that's perfectly feasible within the existing law?
That's our advice. So
and when do you expect to have clarity on that?
We would expect that by the end of this week that we would have greater clarity on it. And we have signalled our intention to do it for this winter, and we're trying to do our utmost to make it happen this winter.